Hello and happy Friday. Now, I wanted to take today to talk a little bit about eye rejuvenation because we've talked about surgery in the past, but surgery does have its limitations. And when we think about the eye, surgery is really great for patients who have a little extra heaviness to the skin or a little extra heaviness to the muscle layer underneath that, or in fact in the lower lid if they have that kind of puffiness because of fat excess or a little bit of skin excess here. But what surgery really can't do well is it can't pull out a wrinkle. And I'll say that whether it's a facelift trying to pull out wrinkles in the face, or whether it's eyes and we have a crepe paper skin here, and in fact, whether patients even have crow's feet. It doesn't really have a big influence on crow's feet. So when that is your concern, well, what are my choices? And that's where resurfacing comes into play. And we have a number of different choices that are worth discussing because of that. Now, it's easiest to kind of work in the most aggressive to least aggressive phase in order to get an idea of what these things are like, because our most aggressive laser is an erbium laser. Now, other offices may have a CO2 laser, but it's my belief that those CO2 lasers are a little bit too hot and they actually cause more damage. They take longer to heal. So an erbium laser is much more precise in that matter. And what that really implies is that we can treat the periorbita, which is the upper eyelid region, the crow's feet, and the lower eyelid region. And we treat that all in one unit. And you do that laser, that's going to take probably a good 7-8 days to heal. It's going to be really red, it's going to be really raw, it's going to be really beefy looking. And in that time frame, you cannot hide. That is something that you actually have to go into kind of submission for to be able to clear that up, put some topical ointments on. Once it heals, which again in that 7-8 day period will leave you with a fairly bright red outcome, that'll take another 3 months or so for all of that redness to go away. Now, it is manageable, meaning you can put makeup on and cover it, but without makeup, it is typical to see some form of redness for months and months to come. So because of that, some patients may opt to do something less than that. But before we leave that, you want to know that that's probably going to correct things by at least 50 to 70% permanently with one single treatment. That is in contradistinction to one of our alternatives, and that is using that very same erbium power source, but now instead of treating all of the skin to the same level, kind of like you're cutting the grass to a same level, it's now puncturing little holes and little columns into the skin, which then will induce that repair process and therefore rejuvenate the skin as well. Now that process is called fractionation, and the laser that we use is a cyton laser, so that is called a profractional laser. Now, again, the idea is it heals much quicker. That acute healing where it's just red and raw is going to cut down from 7 to 8 days to now somewhere between 5 and 7 days. And that redness that persists will dissipate in something closer to 1 month. So it's a much more patient-friendly treatment. However, the total amount of result is going to be a fraction of what we saw in that 50 to 70% endpoint with erbium laser. So in that case, we often anticipate using anywhere between 2 or maybe even 4 different treatments of those separated by kind of an indiscrete specific number of months. So you can do that maybe 6 months apart or something like that. Some people may bundle it up a little closer, but it is something that you're more obligated to do in multiple steps instead of a single treatment. Our office has actually developed something in between those we call erbium light. And what that is a lighter way to use the laser in its kind of mowing the lawn fashion, but not quite as aggressive. And in that setting, that will still get a significant number, maybe say 40 to 60% of those wrinkles out. But that's going to heal again in about a week. And the redness is going to be somewhere in that indeterminate level between 1 month and 3 months. So we have erbium laser, we have erbium light, then we have fractionated erbium. Now, underneath that, you can also use chemical peels. And in this case, we like to do what's called a medium depth chemical peel. It is actually technically a Jesner's 35% TCA peel for those aficionados out there. What that really is that's a really good laser for patients who have pigment issues. So if you think about Mediterranean background patients, a lot of dark color around the eyes, it's a really nice way to actually work really well to leach out some of that extra pigment. It is not as good for when you talk about the crepe paper skin or when you start talking about that kind of cobblestone appearance that the skin can have, or even in the crow's feet. So when we actually pivot to that, we're really thinking more about color. So that's really a great choice, and we can actually add that while we're doing certain eyelid surgery. Specifically, if you're doing a lower lid surgery and you want to leach out a little bit of color, we can do that and blend those together at the same setting. So sometimes that is more commonly used in conjunction with a surgery at the same time. One of the last technologies that's really exciting is now using PRP, or what's called PRF, and a new version of it, where you're actually doing multiple tiny little, not just punctures into the skin, because again, you can actually use that on a surface treatment. Let me back up by saying what it is it's platelet-rich plasma. We take your blood, we spin it, we use the kind of the portion that is the platelet component of it with a number of different components still within there. And we can either use that topically, so that after you make little holes in the skin, like if you're doing the fractionated laser, you can put that in, massage it into those little holes, and patients tend to heal a little more quickly. We also use it on the face when patients do microneedling on the face, or even fractionated lasers on the face. Again, to augment the repair process that microneedling would actually have incited, so it actually induces more collagen. But in the eyes, you can actually use it as an injectate as well. So you could put it just under the skin, because the eye skin is so inherently thin that it's actually an area that holds or shows some of the problems earliest, like wrinkling and fine lines, but it's also one of the most receptive. So in those patients, again, we can use PRP or PRF as an injectable under the surface, and then those basically cellular elements stimulate your skin to lay down more collagen and repair a number of elastin kind of components. So you try to get a little bit more thickness back into the skin and a little bit of snap to the skin as well. And so there are patients that do that as well. It's kind of a cousin of what people used to kind of refer to as the vampire facial. So anyway, so we've got a lot of great technologies for the eye. There are things that the surgery are great, that surgery is great for, whether it's upper lids, lower lids, or combinations. And let me say that a lot of people will combine those to just have a one and done event. Whether it is something like a injection pattern with this PRP and PRF, or whether it is using some resurfacing modality, chem-peel versus the lasers, fractionated versus full field erbium. All of those are really great tools. So if you're interested in that, come in, have a conversation about it, because it really comes down to, are we talking about skin and we're talking about excess skin? Are we talking about excess muscle? Are we talking about crepe and texture of the skin? Because if it's a crepe texture question, that really means resurfacing.